Thank you, Rachel. Flu, RSV, and COVID-19. It's the holiday season and illnesses are on the rise, according to the CDC.
And the agency is reporting RSV cases are likely peaking, flu cases are rising, and COVID-19 is still the biggest concern here in the U.S.
Joining us now to talk about it all is Dr. Paul Anthony, infectious disease specialist with Hartford Hospital. Thanks for joining us. So besides COVID, flu, and RSV, what else are you treating right now? What else are you seeing with patients?
We're seeing it's respiratory season, so we've seen a lot of rhinovirus stuff, and as you mentioned, like a ton of RSV floating around, and yeah, it's respiratory season, so all of those viruses are here.
So here's a question I think will help a lot of people because they find themselves in this situation. Let's say a patient is testing negative for COVID at home but has been experiencing a host of symptoms. At what point should they just go and see a doctor?
Yeah, that's a very good question. I think the earlier is the better because for diseases like the flu, treatment can be started earlier to help decrease the likelihood of complications. And so I would say definitely the earlier is the better. So the lesson here is although COVID is probably the most significant in terms of what can go wrong, but there are other diseases as well going around.
Especially with children, would you say children need to go, like how many, what does early mean, like days-wise in terms of symptoms?
I would say probably within the first 2 days. It's always better to see. For children, as you mentioned, RSV is probably the biggest threat. But
Okay, so we've been discussing RSV here and the vaccine specifically on our newscast from some time now. Last we heard there was a shortage of that vaccine, so I have a couple questions for you. First, is there still a shortage of the vaccine, especially here in Connecticut, and is that vaccine available to everyone? Can anyone get it?
yeah, so in terms of the shortage, yes, there is still some, but I think it's definitely getting a little better. And the vaccine is not for everyone. I think people should talk to their doctor about whether it's right for them. In general, it's mostly approved for folks who are over 60 or with some underlying conditions in terms of the general guidelines. And there's also products available for pregnant women. And so I think it's better that people talk to the doctors about the specifics.
And quickly, can you give us an update on COVID-19 this season, whether it's still a major threat here in Connecticut?
Oh, it is still, because in Connecticut, there's still about 7 people dying per week from COVID-19, so it's still definitely a threat. And we expect those cases to go up starting later this month or early in January. It's RSV now, and it seems to be going towards its peak. Then we expect to see a lot of flu, a lot more flu, and then we expect to see a lot of COVID-19.
Yeah, somebody with a preschooler, I do know that RSV has been going around, and hopefully that's welcome news for preschool teachers, I think, right? That we've seen the peak of RSV, and it might be heading out a little bit. All right. Well, thank you, Dr. Paul Anthony with Hartford Hospital. We appreciate your time.